Hi, my name is Bert Parcells. I'm an orthopedic surgeon and I specialize in hip and knee surgeries. The best way for me to kind of talk about a knee replacement is first to show you what arthritis looks like, and then we'll kind of discuss how the knee replacement fixes the problem. So this is a model here of a knee. And this is the front of the knee. Here's the inner side and the outer side. And if you move the kneecap to the side, here's the kneecap, you're going to see there's a joint surface. I'm going to use a marker here, and we're going to draw on the ends of the bones, okay? And this is where all your cartilage lives, at the end of the bone. And think of cartilage as a cushion, or it's like the rubber on the tire of a car. The rubber wears away, or the cartilage wears out. So over time, you lose cartilage and you're left with raw bone exposed. And that raw bone creates a lot of friction and a lot of inflammation, and that's what generates all the pain associated with arthritis. With a knee replacement, what we're going to do is we're going to just shave off about 6 to 8 millimeters of the worn out cartilage in the bone and replace that with metal. This here is an image or a model of a knee that's been replaced. And you can see that there's shiny metal on the femur, there's shiny metal on the tibia, and there's a piece of plastic between the two pieces of metal. I'm going to remove all of the pieces, and we're now just going to look at the bone. And you can see that the bone hasn't just been cut on the top and the bottom and chopped out. What we've really done here is we've shaved about 8 millimeters off the ends of the bones, which is where that arthritis was. And let's compare it to a regular femur. And you can see that we've just kind of gone along the ends and shaved the bone. And then what we do is we use a medical grade cement or a grout, and we fix the metal onto the bone. And we do the exact same thing for the tibia. And then we put a little piece of plastic between the two because we don't want metal grinding against metal. And this surgery takes about 60 minutes. It's not a long surgery. Most people are able to go home either the same day or the next day, depending on any medical conditions that you have.